Hello and welcome everyone. I'm Jeunesse Castonguay, VP at Clarius. Our team is excited to bring you today's live webinar, Practical Small Animal Ultrasound, POCUS Techniques for Imaging Abdominal Lymph Nodes. In a moment, we'll be welcoming back veterinary ultrasonographer and educator, Dr. Camilla Edwards. During the next hour, she'll explain how to use landmarks to locate abdominal lymph nodes with handheld ultrasound, how to characterize their appearance in feline and canine patients, how to confidently diagnose diseases, and how to interpret ultrasound images with examples of inflammatory and neoplastic changes. Dr. Edwards will showcase pre-recorded exams with Pippi, her Nova Scotia duck-tolling retriever, to help you hone your ultrasound techniques. Following her presentation, we'll see live scanning with Clarius Clinical Manager Shelley Gunther, who will be examining her own furry companion, Mabel, a soft-coated Wheaten Terrier. You can use the question box at any time during today's webinar. We'll address questions in a live Q&A session following the presentation and live scanning. Today's session is in the process of gaining race approval thanks to the Vet Show, so please do stay on for the full webinar to qualify for 1 CE CPD credit, which you'll be able to redeem via an email from the Vet Show in the coming weeks. I'd like to thank all 2,700 doctors of veterinary medicine who registered for today's popular event. Let me introduce you now to your host, Dr. Aron Frankel. Dr. Frankel is trained in emergency medicine in California. A passionate POCUS educator, Dr. Frankel has been using point-of-care ultrasound his entire career. He practices in a busy academic teaching hospital in Vancouver as an emergency physician and serves as chairman of our medical advisory board. Dr. Frankel, hello again.
Hi, Jeunesse. Thanks for having me again. It's always good to be here with our veterinary folks joining in from across the world. To jump in, we're going to set the stage for today's discussion with a quick review of the literature. Start with an old review paper that shows what we'll discuss in this webinar, how ultrasound really is integral to the evaluation of lymph nodes, and not only to diagnose, but also to aid in the biopsy and further workup of patients. This is, like I said, an old review article, so I'm sure the ultrasound use has really penetrated into the veterinary practice since then, and it'll be interesting to see how that evolves. Specifically to the content that we're going to be reviewing, I like this paper that was written by a sonographer who specializes in veterinary ultrasound, who describes how it's really becoming this essential imaging modality across veterinary medicine, particularly in small animals. And we'll continue to see this expanding the experience of ultrasound users over the years. He's speaking specifically around jejunal lymph nodes as one of our topics. And then the other topic we're going to be getting deeper into is into the feline abdominal lymph nodes. And ultrasound is so fast and non-invasive and can really add valuable information to aid diagnostics and treatment. And lymph nodes are an essential structure that can become part of any sonographer's ultrasound examination of the abdomen, both in dogs and cats. With regards to pathology, using the ultrasound can then help us identify specific characteristics that can indicate malignancy and the nature of whether abnormal lymph nodes are hematologic in nature or represent solid organ tumor metastases. And integrating it into the diagnostic exam can provide a significant amount of information in what the right next steps are in your practice. So before we jump into diving deeper into the content, we wanted to put up a poll because we have so many viewers from across the world and in different aspects of practice of what do you see as the key advantages of using ultrasound for veterinary medicine. This allows us to kind of see that everyone's really coming in from different perspectives, but seeing things the same way. So please click on any of the potential options here that relate to you. Are you experiencing or believe that it can provide more rapid diagnosis, help with your diagnostic accuracy when you do see findings, then expedite your treatment plan? Does it help in the more critical patients, stabilizing them in place, help guide your procedures, monitor your treatment efficacy with return visits with the same patient? Or are you seeing more on the business side that it generates more revenue or can increase referrals to your practice, or believe that it can? I see a lot of responses still coming in. We'll close it down in about 5 seconds here. All right. And we can see really the big piece on diagnostics, not just that it's at the top of the poll, but really where people are seeing it, that it can provide more rapid diagnosis, improve the accuracy, and then trickle down to guide procedures, expedite treatment plans, and even generate some business improvements. So we can't think of anyone better to bring back today to help guide us into the topic on lymph node ultrasound than Dr. Camilla Edwards. Dr. Edwards graduated from KVL in Denmark in 2006. She worked in general practice and emergency and critical care in the UK. She achieved her certificate in advanced veterinary practice in 2018 and started her company First Opinion Ultrasound in 2018, where she scans for general practices in the UK, reviews ultrasound machines, teaches ultrasound, and runs an active Facebook community that I'm sure many of you are a part of, with 2,000 vets who are interested in ultrasound. Dr. Edwards, we're so happy to have you back, and I'm going to hand it over to you.
Thanks very much, Aaron. I'm really pleased to be here again. It's always a joy to teach with Clarius. So today we're going to talk about abdominal lymph nodes. As Aaron said, I'm Dr. Camilla Edwards, and I run the business First Opinion Veterinary Ultrasound. I do need to declare my conflict of interest that I'm receiving an honorarium for this lecture. So what will we learn in this webinar? We're going to look at the indications for scanning the lymph nodes and how to find the lymph nodes. We're going to focus in on specifically the medial iliac lymph nodes and the jejunal lymph nodes. And that's because the medial iliac lymph nodes have great landmarks, so that makes them easier to find than other lymph nodes. And the jejunal lymph nodes are the largest lymph nodes in the abdomen, so that also makes them a bit easier to find. But these are not easy organs to start with ultrasonography. So we are assuming a bit of knowledge already, obviously some basic knowledge about ultrasound machine setup and some basic anatomy. And finally, we'll move on to some pathology and some cases. So what are the indications for scanning lymph nodes? Well, I scan lymph nodes as part of the full abdominal ultrasound scan. So potentially anything that I'm scanning in the abdomen, I'll be looking out for lymph nodes as well. This will give us more information, particularly if we're worried about cancer, whether it's spread or not, but also about inflammatory processes going on inside the abdomen as well. And also a key indication for scanning lymph nodes is if we have some neoplasia, particularly in the hind limbs or in the abdomen itself. We want to check the draining lymph nodes from an area of concern. So what exactly are you looking for when you're scanning for lymph nodes in the abdomen? Well, the good news is that it's pretty similar in both cats and dogs, so there's not too many differences between them. But we're looking for lymph nodes which are hypoechoic to isoechoic structures, and they're usually ovoid in shape. In both cats and dogs, the length can really vary, but the width is pretty standard. So in cats, we expect that to be under 0.5 centimetre in thickness, and in dogs, we expect them to be under 1 centimetre in thickness. So those are pretty good standards for what we're looking for normal sizes in dogs and cats. The abdominal lymph nodes that we're interested in are the visceral lymph nodes, so those lymph nodes that drain the viscera itself and are closely associated with their particular organ that they drain. So we're thinking about splenic, gastric, hepatic, renal, jejunal. Jejunal ones are really key because they're the biggest lymph nodes in the abdomen, so we're really interested in those. And then we have the parietal lymph nodes, which can be split up into the lumbar and iliosacral, which are a little bit further caudal than the lumbar. And these lymph nodes drain, the aortic nodes drain the diaphragm and the ribs, and the structures outside of the viscera in the abdomen. And the iliosacral lymph nodes tend to drain sort of colon and rectum and hind limbs, everything that's going on in the pelvis and beyond, really. So the two that we're really focused on today are the jejunal lymph nodes and the medial iliac lymph nodes. So here we've got a schematic of where we should find those lymph nodes. They will be closely associated with the organs, the visceral lymph nodes. And in particular, we're interested in the jejunal lymph nodes, which will be found in the mesentery. Lymph nodes are often found in pairs and often have a blood vessel running between them, so that can give an indication that if you found something that might resemble a lymph node, that is what you're actually viewing. And then the medial iliac lymph nodes, number 8 there, those are also the ones that we're interested in, of those lumbar and iliosacral lymph nodes. So how do lymph nodes look when they're normal on ultrasound? Well, we talked about that they're ovoid in shape. They're usually hypoechoic, so slightly darker than the surrounding tissue, but they can be isoechoic, which makes them very difficult to spot. They are homogeneous, so not really a variability in echogenicity, but they can have a slightly hyperechoic center. We always measure the width, and this is because that varies the least. It usually only varies if we've got pathology present, whereas the length of these lymph nodes can vary enormously. We can even get lymph nodes, jejunal lymph nodes, up to sort of 6 centimeters plus in larger dogs. But we want to find lymph nodes that are under 1 centimeter in dogs and under 0.5 centimeter in cats. And we need to remember that normal lymph nodes in younger patients tend to be prominent and much more obvious. So don't mistake that for pathology. Obviously, younger patients can also have pathological processes going on in their lymph nodes, but typically the lymph nodes are much more obvious in our younger patients. So here's an example of a left medial iliac lymph node. So we've got the aorta coming across the screen here, and we get to the trifurcation. So we have the external iliac artery leaving the aorta here and the aorta continuing. We can't see the opposite external iliac artery at this angle that we've got, but this is the trifurcation, very characteristic looking. And this is the spot where we will find the left medial iliac lymph node. And this is this hypoechoic structure just here, very tiny. This is a normal patient, so not very big at all. Here, however, we've got a young dog, so only 10 weeks old, that we were scanning for urogenital problems, which turned out to be ectopic ureters. So we weren't expecting any problems with the lymph nodes really, but just to demonstrate how large lymph nodes can be in our younger patients, we've got the vessel running here in between, which is very characteristic for the jejunal lymph nodes. And then we've got one lymph node here and one lymph node here. And they're quite hypoechoic, dark in comparison to the surrounding tissue, and they're quite large really, and very prominent. So we expect to spot them in our younger patients, whereas we might not spot them in our older patients quite so easily. So what does it look like when a lymph node is abnormal then? So they get larger, they get rounder, and they get darker, so hypoechoic, and they can become heterogeneous as well. The pathology that we're really interested in finding out with lymph nodes is, are they reactive? So is there something inflammatory going on? Is there primary neoplasia in these lymph nodes? Or have we got metastatic neoplasia in these lymph nodes? And to get a diagnosis, we often need a fine needle aspirate or a biopsy for definitive diagnosis. And that's because there's a big overlap. So the larger, the rounder, the more hypoechoic or heterogeneous the lymph node is, the more likely it is to be malignancy. However, there's a big grey area where inflammatory and neoplastic lymph nodes overlap in their appearance on ultrasound. So we really do need to be taking those samples to get our answers. So here's an example of neoplastic lymph nodes. So again, we've got the aorta coming in across here, and we meet the trifurcation here. So we've got the external iliac artery shooting off here, and we've got a hypoechoic structure here, which is our left medial iliac lymph node. But not only that, we wouldn't normally see many lymph nodes in this area, but we can see a lot of the other iliosacral lymph nodes, which are quite large as well. So we have one here just below the external iliac artery, and we have another one down here. So multiple large, round, dark lymph nodes in this area. And what we found was that this dog had a transitional cell carcinoma in its bladder, and it had spread locally to these draining lymph nodes. So we'll move on to how we find the medial iliac lymph nodes. So the medial iliac lymph nodes are really useful to find in the abdomen because they've got great landmarks. So we saw in the other images that we were looking along the aorta. So we've got the aorta here. This is the left-hand side of the body, and the caudal vena cava is on the right-hand side of the body. And then when we get back to the trifurcation, we've got the two external iliac arteries, and the aorta continues. And it's at this point where we see the medial iliac lymph node, usually lying just alongside either the aorta or the external iliac artery, or in that bend there. That's what we're looking for. So here I'm scanning on my dog Pippi, and we're looking for the aorta first. So at about the level of the kidney, I'm looking up dorsally towards the spine, and I find this anechoic tube here. So what I want to do once I've found the aorta is I want to rotate the probe so I get a really nice longitudinal view. So there we go, I just rotated so we get the black tube, the aorta going right across the screen there. And so we follow that caudally until we get to the trifurcation. So that trifurcation is happening here. So we've got the aorta running along here, and then we have the trifurcation. And we fan in that area. It can be useful to release some pressure. That gives us a bit more room between the probe and the aortic trifurcation for us to look in for this lymph node in this area. So that's what we want to do, but sometimes a descending colon can get in the way, and we'll need to apply a bit more pressure to get that to move out of the way. So once we've located the lymph node in this area, and sometimes we don't always spot it, but that's usually a good sign. It normally means that it's normal. We can take a measurement and have a closer look at it there. So it's just this really hypoechoic structure.
Yeah, I was going to say you can really see how. Yeah, I was going to say you really can see how you need that image quality to be able to see that small structure. I'm seeing your measurement going in at about 0.5 centimeter there on Pippi's lymph node.
Yeah, absolutely. They're really small structures when they're normal. So you really need to have a good quality image to be able to see them. Absolutely. So here I've taken a still image so we can see it a little bit better. We've got the aorta coming in here, the external iliac artery here, and we've got the aorta continuing along here, and we're looking for a hypoechoic structure lying up against the external iliac artery, or just a little bit caudally along the aorta. So we can see the lymph node here, but as I say, it can be very, very difficult to spot this lymph node. And usually if you've found in this area and not seen anything abnormal, then you can be pretty sure that the lymph node is normal in that area. So to summarize, finding the aorta and the left medial iliac lymph node, I had Pippi in right lateral recumbency, and I'm finding the caudal end of the left kidney and pointing the probe in a craniocaudal orientation. I look up towards the spine, fanning in that area until I find an anechoic tube. Often you won't hit it on longitudinal straight away. So once you do find that tube, and sometimes it can be a complete transverse you get, so looks like a black circle, then you'll need to rotate the probe until you get a really nice longitudinal view of the aorta. Then you want to follow that caudally until you reach the trifurcation. And in that area is where you want to fan. Usually it's quite close to the aorta, sometimes a little bit of fat or mostly fat can push it a little bit away from the aorta, but it should be lying relatively closely up against it. And if we want to find the right medial iliac lymph node, we repeat the procedure exactly the same on the right-hand side, but we just have to remember that the caudal vena cava is closer to us then, so we need to look for that blood vessel that's just slightly further away from us. And the procedure is exactly the same in cats as well. So moving on to the jejunal lymph nodes. So these are a pair of lymph nodes, and we get some mesenteric vessels running between them. So often it can be easier to spot the vessel first within the mesentery. And then we're looking around this vessel for two quite elongated lymph nodes. They can be 6 centimeters plus in dogs. We're most likely to see them on the right side, and that's because the spleen often gets in the way on the left-hand side. It's deep within the mesentery, and we're looking out for that vessel first. And we fan over that vessel if we spot it. So here I'm scanning Pippi again. So this time she's in left lateral recumbency. And I'm starting up very high dorsally on her right-hand side, right up where the costal arch meets the lumbar musculature, or by the right kidney, basically. Then I'm doing a castle pattern on this side. So I'm bringing the probe down, sliding very slowly over her abdomen to look for the jejunal lymph nodes. So in Pippi, she's a normal, healthy dog. So they're not very obvious at all, but they're just popping into view here and here. And we have a blood vessel running between them as well. So that helps us to spot it a bit more easily. But you can see that they're very isoechoic, very similar to the surrounding tissue. And again, it really does depend on your image quality of your machine a lot to be able to spot these. So again, we're seeing them in this area here. So we have the
good news is with the pathology is more notable, right? Like if there's abnormal lymph nodes, they will pop up much more readily, but it shouldn't discourage people from scanning to get to know what they should expect and then be surprised by the pathology.
Exactly. So yeah, we love practicing. Practicing is really useful and gets us used to what normal is, but don't be disheartened if you don't find these lymph nodes in every patient. If you're looking in the right areas, you'll see them when it's important. So this is a still image of the videos we've just seen. So just to demonstrate how isoechoic they are, we've got one jejunal lymph node down here and one here. So just circled there. And we've got this mesenteric blood vessel running between them, which can be a really useful indicator that we've got jejunal lymph nodes there. So in summary, to find the jejunal lymph nodes, we have the dog in left lateral recumbency, or the cat. Is exactly the same procedure for cats too. They can be seen from the left, but the spleen tends to be a bit in the way and we can't get as close to them as we'd like. It can be difficult if there's lots of gas in the intestines to spot them, so it's easier to find if the animal's starved as well. And we basically try to find the caudal end of the right kidney, or get right up into that top corner where the costal arch meets the dorsal lumbar musculature, and then we slide ventrally down the body. And we're looking out for two long hypoechoic lymph nodes with the cranial mesenteric artery running between them. That's probably more likely what we'll spot first. If we don't spot it straight away, just carry on slowly all the way ventrally, move a little bit caudally, and then move up again. Usually it's a little bit caudal and a little bit ventral from the caudal pole of the right kidney that we'll find the jejunal lymph nodes. So let's have a look at some cases now. So we've got this cat who's male-neutered 13-year-old domestic shorthaired cat with a history of diarrhea. And on clinical examination, the vet could found a small mass in the abdomen. So we came to scan this cat, and what I found was in the abdomen, in the area of the in the mesentery, that these jejunal lymph nodes, which were extremely rounded. So we have one here, and we have one here, and we have the vessel up here as well. What we also found was that this intestinal loop was abnormal as well, so that the muscularis layer, it was thickened in this area as well. So there's most likely some connection between these. The other thing that was noted was that there seems to be some reaction in the fat around these lymph nodes as well. So here we've got the still image where we've got the jejunal loop with the thickened muscularis layer up here. We've got a blood vessel here and the two enlarged and rounded and hypoechoic lymph nodes here. So these are pathological abnormal lymph nodes that we're finding here. And there's the blood vessel there. So we took some fine needle aspirates of these lymph nodes, and we found that that the samples were consistent with inflammatory or reactive lymphoid tissue. And this was consistent with inflammatory bowel disease in this cat. So we continued the medical treatment for this, but the owners were reassured that there wasn't a cancerous cause for this or anything more concerning, and we could continue to try and treat this medically. Our second case was another cat, a female neutered 12-year-old domestic short-haired cat with a history of chronic diarrhea. So similarly, we found that there were some enlarged lymph nodes in the abdomen. These weren't the jejunal lymph nodes. So these were lymph nodes that I don't typically see every time that I'm scanning. But around the ilium, so close to the cecum and the ilioceco-colic junction, we found these lymph nodes within this tissue here around. So we've got the ilium here, and we've got these hypoechoic areas. Now, these are not particularly large lymph nodes, but they're significant because they're not lymph nodes that I would normally come across, and they're quite hypoechoic as well. So they don't necessarily always have to be enlarged. If they're not lymph nodes you'd normally see, so often a lot of the visceral lymph nodes you won't see every time, but if they're rounded, darker, and more prominent, then that's also significant. So in this case, we've got the ilium across here, and we had a lymph node here that was rounder, larger, darker than we'd expect. And again, over here, we've got some enlarged, more rounder, more prominent lymph nodes than we would expect. So we took some fine needle aspirate results, some fine needle aspirates, ultrasound guided, and unfortunately it didn't give us a conclusive answer, but we didn't find any cancerous cells, and it was most likely an inflammatory process going on. But the owners declined any further workup that we would have liked to have done, as the cat was also suffering from chronic renal failure. So they decided to go with palliative care. So what are the take-home messages today? So we need to know what we're looking for. So we're looking for lymph nodes that are often paired around a vessel. They're usually ovoid and slightly hypoechoic or isoechoic to the surrounding tissue. And they are difficult to spot when they are normal. So just keep practicing and looking in the right areas. And when they're pathological, like Oren says, then they become more obvious, and you'll spot them more easily. So what are you looking for when we're looking for those pathology changes? We're looking for a lymph node that's more rounded than we'd expect. We're looking for a lymph node that's over a centimetre in size in dogs, if it's pathological, or over half a centimetre in cats. The only disclaimer I'd say for that is if we're seeing lymph nodes that we wouldn't normally see when we're scanning the abdomen, if they're more prominent and more rounded and darker than we'd expect, then I would still assume that they might be pathological. And echogenicity, again, is an important thing to look at. So if they're heterogeneous or they're darker than we expect, then that can be an indication of pathology. So the key thing here is to practice, practice, practice. That will help you improve your skills at finding the lymph nodes, but equally, if you're not finding them, you will spot them when they're pathological. So thank you so much for listening to me and talk about lymph nodes today. I have put up a free gift for you guys. It's an ebook to help you get started on your ultrasound machine, whether that's a Clarius or not, and includes my review of the Clarius machine as well. You can find that out at fovu.co.uk/Clarius, and do get in touch with any questions you have. And my email is up there on the screen, camilla@fovu.co.uk. I also just want to tell you about some upcoming courses. So I've got 3 courses on my website. The basics will take, is best for vets really, and it will take you from not knowing how to use your ultrasound machine at all through to being able to scan the large organs of the abdomen confidently, and making sure that you're doing that in a systematic way and knowing what pathology to look out for. The trickier bits is a little bit harder, and that includes lymph nodes in that. Also, that's a 4-week course with pre-recorded webinars, and I also have a course for nurses and techs, which is 6 weeks online with pre-recorded webinars, and you can start that anytime. You can find those courses at fovu.co.uk/ultrasound-courses. Thank you very much.
Great, thanks so much, Dr. Edwards. And I see all of you, many of you are already filling the Q&A pretty heavily here. So please keep doing that. We'll have time to get to as many questions as we can cover. Before that, we're going to show a live demonstration of going through scanning the lymph nodes with Shelley Gunther.
Thanks so much, Ron. And thanks, Dr. Edwards. I have my dog Mabel on the table over here, and she's being very cooperative right now. So I'm going to just start off by trying to find her left medial iliac node. And Dr. Edwards, I'll hope you'll walk me through it. I've learned so much from you already, just from the webinars, and I never would have really approached ultrasound on my dog before, but it is definitely getting easier. So I'm going to head over and we'll start scanning little Mabel here. So I'm just kind of starting up by where you said the left kidney here. She's pretty gassy. She's had lots of treats at the office today.
Yeah. So I think so we want to look about where the right kidney is, looking up towards the spine to look for the aorta.
So I think I'm starting to see it right here.
Yeah, that
aorta.
Yeah.
Okay, so I'm just going to do a little swipe here and just try and get that lengthwise.
I suppose fasting your patient makes it easier if you're going to do the scan.
Exactly. Yeah. Gas can really get in the way. Well, of scanning anything in the abdomen, really, but yeah, particularly lymph nodes, particularly the jejunal lymph nodes, it can really get in the way.
Okay.
So that looks like a kidney.
Okay, there's the aorta there, pulsating away here.
Nice.
Right.
Okay.
Always nice to see.
Okay, so I'll just point that down inferiorly a little bit, and there
Yeah.
looks like I'm starting to see the trifurcation.
Excellent.
So
Yeah, we can just see the caudal vena cava in the distance as well.
right down
lower
here.
part.
Okay.
Yeah, absolutely. So
Okay,
if you're scanning from the other side, the caudal vena cava would be closest.
Okay.
But
All right, so
yeah, so you've got really nice, you can see the aorta and you can see the external iliac artery there. So we're just looking, if you can move the probe a little bit further caudal, so you're getting that aortic trifurcation in the center of the image, that's great.
okay.
Because that really brings into the center what the area we're looking at. And I can already see a little hypoechoic structure, not right up against the external iliac here, but just a slightly
right here.
Yeah.
Okay, so I'm going to freeze my image here and just back up a couple of frames. And so this is the area right here that you're talking about, right?
Yeah, so it's a really nice long structure. It's not rounded. It's really similar in echogenicity to the surrounding tissue. So a really nice normal lymph node there.
Okay, and it's only 4 millimeters in width, so that's normal
So
for Mabel.
Much under a centimeter. So that's really good news for Mabel.
Excellent. Okay,
Yeah,
there.
so
I just eased off on the pressure a little bit, and I got a much better image. So yeah, it's like you were saying.
Exactly. So that can really improve the image, just releasing that pressure. So not everything's all squished together in that area. That can just give room for the lymph node to be. But we do have the descending colon on that side, and sometimes that slips in as we release the pressure. And you can just get gas artifact then. So it's a balance between as much pressure as you can release without letting the descending colon get in the way.
It's funny, as a sonographer, your kind of habit is to, if you can't see something, you just press harder. It doesn't always work.
No, pressure is one of those things that often people aren't aware of how much pressure they're applying as well. I see that a lot when I'm teaching, is people know when they're sliding or fanning or rotating, but they're not as aware of when they're adding too much pressure or even not adding enough pressure. I think people fall into two camps. You either apply too much pressure or not enough pressure. But it's a skill you need to, for some things you need to release the pressure, and for some things you need to add pressure. And this is definitely one where you need to release the pressure. Now,
if we have time, I'm going to attempt to just flip her over, and we'll see if we can find the other side.
So on the right hand side, it's very similar. We just have to be careful that we've got the aorta and not the caudal vena cava that we're following.
Okay. Oh, I see. Okay. So the vena cava is on top.
It is on top, and you can play around with the pressure there as well, because the pressure will compress the caudal vena cava, but you won't be able to compress the aorta. So so try and follow the aorta. That's lovely. Yeah.
Actually, the trifurcation looks more like a trifurcation from where I am here.
Yeah. So this angle, it's great. You've got both external iliac arteries coming off there, so you can really clearly see the trifurcation. And then we're similarly looking for a hypoechoic structure lying up against the external iliac artery. Nothing's jumping out at me just yet.
Is it going to be like kind of sitting on top of it like we saw before, or not necessarily?
Yeah. So it's very similar to the other side, but sometimes we need to fan a little bit in that area, in that region.
That may be it there, or is that too high?
No, I think that could well be it. Yeah.
Okay. All right, I'll just freeze my image, and then I think this is the area that we're looking at right here.
Yeah.
I can zoom that up a little bit and we'll do a quick measurement just for fun. And I'll take a picture. Excellent.
Yeah. So, but you can see the left one was more obvious than the right one, I feel.
Yeah, definitely.
That's fine. You know, I won't necessarily find both of them every single time, every abdomen that I scan, but I will look for it. And I feel fairly happy if I found in that area at the aortic trifurcation that if I'm not seeing anything there, then the lymph node is very likely to be normal.
Okay, good. All right, now, so if I want to find the jejunal nodes, I'm going to go, am I in the same area or just a little bit more cranially?
Yeah, so what I would do for that is start a little bit more cranial, so where the costal arch meets the lumbar musculature. But I would also increase my depth because we may be looking at something that's slightly deeper into the abdomen.
Okay. A lot of gas there.
Yeah, slide slowly down the wall of the abdomen to the midline. So going ventrally rather than caudally.
Okay.
So we've got some loops of intestine there. Oh, I think we've got the aorta there.
Yeah.
Now we're quite dorsal, so we just slide down. That's it. Yeah, lots of gas in those intestines. So that will make it harder to spot those lymph nodes.
Am I possibly seeing something here? Or
yeah,
is that...
yeah. I think I'm looking at the same thing, thinking. Oh,
okay. Okay, so just right in this area right here. Yeah. Okay. But definitely not anything that looks enlarged or rounded in shape or anything.
No, exactly. They look long and thin there, so that's very promising.
Okay, good.
Yeah.
Right. Okay, great. Thank you, Dr. Edwards.
Yeah, so to bring it back together, you know, just as a review of things that we covered on how point of care ultrasound seems like it can help your practice, not just for lymph nodes, but also beyond. You could see here how, would you agree, Dr. Edwards, how access to ultrasound, if you're doing an abdominal exam, would speed diagnosis on a patient's first visit, where you found the lymph nodes and maybe even did the biopsy on the same visit?
Absolutely. You know, it saves the patient, the client coming back with the patient later on, or even going to a separate center to get that diagnosis. And it means that you can keep that in-house. You can do the follow-up surgery, whereas if you've referred the patient out to a specialist clinic, then they may do the surgery that you were capable of doing in-house. So yeah, right. Definitely.
You might not see them again.
Yeah.
And then I imagine it leads to better results. You know, you can initiate treatment better on those patients, get the diagnosis, and kind of move forward more quickly.
Absolutely, really helps with decision making. Yeah, what treatments are necessary, whether to pursue any treatments, but it gives the clients and the vet that information that's needed to make those decisions. Yeah.
Great. And everyone saw how, you know, quite easy it is to just use the app-based ultrasound and do the measurements right on the smartphone or tablet that we all carry with us, and how minimal impact and restraint. You saw Mabel, well, there was no sedatives involved in doing that examination, and it was done right at the bedside, cage side, wherever you need to. And would you say, lastly, that you've experienced, you know, improved word of mouth referrals and client satisfaction, and maybe even improved revenues in your practice?
Yeah, absolutely. Like I said, you know, managing to keep people in-house really does make a difference. Clients really like that with a vet practice, not having to travel around and being able to get all that information in one place. So definitely.
Yeah, I can imagine. Great. Well, we have time left. Please keep filling out the Q&A. There's a lot of questions that we're going to hopefully get through as many as we can. I'm going to hand it back to Janez before we go to Q&A.
Thank you, Dr. Frankel, Shelley, and Dr. Edwards. Before we begin our live Q&A, we do have a question for you. This poll is an opportunity to learn more about our 3rd generation Clarius wireless ultrasound scanners for your veterinary practice, which are now available in dozens of regions around the world. Please complete this poll to let us know if we can provide further information. And click on as many options as apply. Pricing and availability do vary by region and currency, so please do feel free to request a quote and pricing. You may opt to speak to one of our experts about the advantages of wireless ultrasound. And if you'd like to discuss scanner features, please select that option. You can also book a virtual one-on-one demo with our experts to see the new Clarius HD3 in action. And we can send you more video tutorials for veterinary medicine. Zoom, with so many of you joining us today, sometimes doesn't have as fast a frame rate as we wish we could show you. So we can send you more video tutorials and you can see what the experience would be for you directly without Zoom getting in the way. Please go ahead and select as many options as you wish. While you take a minute to participate in this poll, I'd like to tell you about our newly released HD3 version of our Clarius vet scanners for the highest definition wireless ultrasound imaging to speed diagnosis for small, medium, and large animals. Our C3 HD through micro-convex vet scanner, which you saw in action today, is specifically designed for clear clinical imaging for small and medium animals like cats and dogs. We also have the C3 convex vet for larger animals like sheep and horses, and the L20 linear vet for superior animal MSK imaging, often used in equine applications. Now 30% smaller and lighter, more affordable, and with an enclosed battery, our 3rd generation family of vet scanners are available almost worldwide, and they deliver several advantages. Clarius HD3 is unrivaled for high definition imaging and handheld ultrasound with dedicated animal presets. Clarius shows you the fine details you need to investigate an area of concern, perform a fast exam, and make a confident diagnosis on your patient's first visit to expedite the right treatment plan. Each scanner is designed with 8 beamformers and 192 elements that deliver the image quality and speed only found in traditional systems, but at a fraction of the cost. Artificial intelligence replaces complex knobs and buttons, making our scanners fast and easy to learn and use. Clarius is also wireless with 0 footprint for high portability to scan animals where they are, from the vet clinic to their homes, from the cage side to the floor. You get free movement with no wires getting in the way or startling the animals, also making it so much faster to clean and disinfect. And only Clarius delivers wireless scanners with an ecosystem that includes a free app for your iOS and Android devices with free updates. Available with our new membership, Clarius Cloud is available to capture and manage ultrasound exams from anywhere. Your membership includes in-app Clarius videos with experts like Dr. Camilla Edwards and onboarding with clinicians to build your ultrasound scanning skills. And with Clarius Live, we get one-click telemedicine if you'd like to share live scanning with a colleague for a second opinion. And there's a new advanced veterinary package that offers more flexibility for users who need additional and advanced workflows for various animal examinations, for example, with access to finely tuned presets categorized by application and anatomy. For clinicians who prefer a one-time purchase over a membership, the advanced package is available as an add-on purchase. With advanced ultrasound billings, you see rapid return on your Clarius HD vet scanner, which is ultra affordable. We'll now take 3 seconds to close the poll to allow you to request more information. 2, 1. Thank you for participating. We'll get back to you in the coming week. We also have one final poll prior to our Q&A session. We'd like to invite you to pre-register for our next veterinary webinar. Please click yes in the poll to save your seat for our July 27th webinar, Veterinary POCUS, Assessing Acute Animal Conditions under the Rapid 5-Point Abdominal POCUS Exam. Internist Dr. Soren Boysen and criticalist Dr. Serge Chaloub will teach rapid point-of-care ultrasound techniques to diagnose acute abdominal conditions in under 5 minutes at the cage side in their banter-filled and very dynamic educational session. I'll give you 5 more seconds to save your seat. 4, 3, 2, 1. Okay, let's now begin our live Q&A session. I see we've got dozens of questions. Please do use the Q&A icon in the menu bar to ask your questions for Dr. Edwards. And because this is a common question, I do want to let everyone know that in the coming days, we'll send you an email with the recording of today's webinar, as well as a copy of the presentation in PDF format. And you will also receive a link from the Vet Show via email to redeem your CE or CPD credit once it becomes available. I'd like to welcome back Dr. Frankel to moderate our Q&A session with Dr. Edwards.
Great. All right, let's just jump right in. Dr. Edwards, a lot of people want to know exactly what is the castle pattern.
Yeah, so that's probably my English coming across there. So I believe in the US it's called the battlefield. It's what you will have done with microscope slides. When you're trying to assess a whole microscope slide, you'll move down and across, up, across, down, across, like that. And I believe that's called the battlefield in the US and possibly in Canada as well. So I hope that makes more sense, but that's what you want to do across the abdomen. It just maximizes your chance of spotting something, but moving in a systematic way with purpose rather than just randomly looking across the abdomen.
Is there a way, a lot of people are really excited about your ebook. Is there a way you could just kind of guide them again? This, to answer like Janez, a copy of this will be sent to everyone of the webinar, and so you'll be able to get it then. But if you could just maybe say again what the link is.
Yeah, it's fovu.co.uk/Clarius.
Okay, so if they go to your website, they'll find it through there.
Yeah.
Great. How about, people want to know more about FNAs. What do you do to kind of stabilize the patient? What's the risk of complications of doing it? And then do you use the same ultrasound probe that you're using to find the lymph nodes to guide your biopsy or your FNA?
Yeah, so when you're doing an ultrasound guided FNA, you obviously need the animal well restrained. You don't want risk of movement at a critical time. So I usually sedate my patients, and that will really depend. People always want to know, what sedation do you use? Well, I think the most important thing is that you're using drugs that you're familiar with. And also drugs that are suitable for the patient's condition. So it really does vary, and there's no one correct answer. Once you've got the animal restrained, and that can be with sedation or a general anesthetic if that's better for the patient, then you really want to find the best route to the pathology. So you want to get as close as possible to the pathology, and get the best image you can get of the pathology. So, and then be sure that you're not going to go through any blood vessels or any other organs. So switching Doppler on is really useful for getting that assessment. You won't necessarily get the angle or come from the same position as you are when you're systematically examining it. You need to find the best position, and that might mean the animal's in dorsal recumbency, or it's in lateral or a slightly oblique angle. You just need to find that best position. And yes, you can use the same probe. In those cases that you saw, I used the Clarius probe, as that's what I was using to examine those animals, and that's what I was getting the best image with. So yeah, you can absolutely use the probe that you're using, whatever microconvex probe is best for looking at those lesions. Yeah.
Do you ever use color, or there's some advanced users on here asking about calculating a resistive index to denote neoplasia or increase your suspicion there?
That's not something I'm familiar with using. Yeah, I know there's all sorts being used in the human world, which you probably know more about, with how elastic tissue is. That can be measured using ultrasound, and that can give you an idea of malignancy, but it's not something that's being used in general practice in the UK at the moment.
I won't go too much into it then. We can leave it there. At what age do those giant lymph nodes not get as easy to see? Like you made it look so easy on the young puppy that you scanned. It's like, oh, those lymph nodes, all of us could see really easily, like little sausages in there. But when is it no longer the sausages in the belly?
So that was a really young puppy, 10 weeks old. So those lymph nodes, will be really prominent in puppies and kittens that age, and then they will get less and less obvious. So up until about 18 months old, they will be more prominent than in an adult animal. But it's really useful because you can practice on these young animals finding those lymph nodes because they're more obvious. So your patients that you're neutering, they tend to be young animals. So try and get an ultrasound scanner on them and practice finding those lymph nodes because they will be more prominent, and it's a really great thing to practice on those.
Yeah, anchor your confidence, find the big nodes, and then you know where to look for, and you'll start seeing those, especially those isoechoic ones are pretty hard, even for a skilled eye, I imagine, to spot.
Yeah.
Okay. A common question, this comes up every webinar, how do people know what they're looking at, and how can they learn better to develop their skills beyond just practice to understand pathology and interpret the images?
Yeah, so definitely practice is key, and scheduling out time to practice as well, making it easy to access your ultrasound machine, having it in a prominent place, but also going on a course. Definitely have had lots of people go through my courses, my online courses, who are then better able to find those structures after those courses. So getting a course or an in-person course can be useful as well, get familiar with those landmarks that you need, and then practice is the key thing. Great.
People wanted to know, do you ever scan in dorsal recumbency? Can you find the nodes that way?
You definitely can find them in that way. I was taught in lateral recumbency, and that's what I've continued to do. So yeah, absolutely. But there are definitely lots of vets out there that scan in dorsal recumbency. We tend to not sedate our animals so much in the UK, so it's much easier to get a nurse to restrain in lateral recumbency rather than dorsal recumbency. So in the UK, it's quite common to scan in lateral, but absolutely it's possible to find these structures in dorsal.
Great. And I'm going to squeeze one last one in. Any suggestions for veterinary nurses who want to pursue ultrasound, either transmitting images to a veterinary radiologist or other opportunities for them to scan?
Yeah, so I think that's really up and coming, certainly in the UK. I think technicians in the US are doing a bit more with scanning. I know they're doing cystocentesis and things like that. I think triage in the emergency patient is a real key area where nurses can get involved. And yeah, I've got a course for nurses as well on my website. You can go and check that out. And yeah, that's really the key area, I think, where nurses can get involved, triage.
Great. All right, well, we're at the top of the hour. We wanted to thank everybody for their time. If these questions that we didn't get to, we will certainly be following up with everyone if we didn't manage to answer your questions. And I will hand it back to Janez to take us home.
I'd like to conclude by thanking the star of our show, Dr. Camilla Edwards, and our furry supporting characters, Pippi and Mabel. A big thank you to Shelley and Dr. Frankel, and thank you all for joining us today. We hope to see you again for our next POCUS webinar on July 27th. See you again very soon, and keep scanning.
Cheers.